Hey team, good afternoon and welcome back. This is Nurse Eunice, and in today's video, I'm helping you pass the medication aid / the med tech examination. That is right. This video has been requested from multiple viewers, so we thank you for your patience. And as we do in each of our videos, we're going to give you about 10 seconds to receive your notification. So we're going to get started shortly. Today, I will not be monitoring the chat. I do apologize. We have 70 questions to get through, and I want to get through them in a timely manner. So let's go ahead. Let's get ready to get started. If you're unaware, I do have my own online CNA course that is good globally. No, it's not going to certify you. It's going to prepare you for your certification. So if you're having a hard time understanding, if you need flow sheets, if you need a question bank, scan the QR code, open up your camera app on your phone, scan the code, and there's going to be a link that pops up. Click that link. It's going to take you directly to Nurse Eunice's online CNA course, or you can go to fltraining.com, which is also on the screen. And when you go there, the 3 lines up top would be the menu. You can click on online courses, and you can also access the online CNA course directly from our website. There's no commitment. So if you can finish your materials in, 3 to 4 weeks, that means that you only paid $29.99. But you all, it is awesome. And our students are passing. So thank you for trusting Nurse Eunice. Some of you asked for more resources, and I apologize. I have about 5 different med tech medication aid videos. I finally compiled them into a playlist. So use your phone, open up your camera app, point it towards this QR code. A link will pop up that will take you to the playlist on YouTube. So if only thing you need are videos to help you pass the med tech or the medication aid. We use those terms interchangeably. If that's all you need, you don't want CNA, you don't want CPR, use the QR code. It's going to help simplify your life. All right, so let's get ready to take our practice test, everybody. I want you to find a quiet space so you can focus. Go ahead and have some scratch paper handy, also a pencil or a pen. We're going to read each question, and then I want you to trust your instincts. You already have the heart for patient care. In some states, I'm going to talk about Florida because that's where I'm based. In the state of Florida, a CNA with 1 year of experience can become a qualified medication aid. That's a QMA. Prior to that, anyone who's unlicensed can take a course to give medications to be a med tech or a medication aid. I don't think that's the safest route. I would prefer for you to have some knowledge of healthcare, blood pressures, etc. But I want you to really consider, look at your state's protocols, your state's rules. This is somebody who is not a nurse. They're not an LPN. They're not an RN, but they are able to give medications with limitations. So you won't be able to do everything, but that would be a way for you to be in the medical field without necessarily working the role of a certified nursing assistant or a patient care tech. Remember, I'm in Florida. You have to know your state's rules, so do some research on your end, but look up medication aid, medication tech, or you can also look up qualified medication provider. All right, let's get going, team. Question 1. What is an important consideration when dealing with medication interactions? A, discuss your concerns with the licensed nurse. B, discuss your concerns with the pharmacy tech. C, discuss your concerns with the physician. Or D, discuss your concerns with the patient's family member. We have 70 questions that we're going to review today, so I won't be monitoring the chat, but I do love you all. Hello, hello, hello. If you feel that I'm revealing the answers too fast, you can always rewatch the video. You can slow it down. You can pause it, or if you use these settings, you can change the playback speed. So everybody, the correct answer for question 1 is, of course, A. That's right. Medication aid should not assess or manage interactions. What you're going to do is, if you think the patient's having a medication interaction, you're going to involve that nurse. The nurse has to come in and assess that patient, and she will decide if a doctor needs to be called or notified. Sometimes your patients, they may already have some type of anti-inflammatory or antihistamine ordered, but you have to get your nurse in the room for further assessment. Question 2, a resident's blood pressure medication was scheduled at 8 a.m. It is now 8:59 a.m. What is the most appropriate action? A, administer the medication and document it as if it was given on time. B, do not give the medication and continue your med pass. C, ask the nurse to give the medication instead. D, review the facility's late medication policy and follow the physician's order. This one's tricky. Revealing the response in 3, 2, and 1. You all, it would be D. Some facilities do give an hour window, but that's for certain medications. That's not for every medication. So med techs must follow their facility's protocol for administering medications outside the scheduled time frame. Again, most facilities will allow a grace period, which is typically 1 hour before or after the scheduled time, but you have to make sure this is verified, make sure that's accurate, because giving a medication late without proper documentation or skipping it entirely may result in a medication error. The nurse should be notified if the med is beyond the allowed time frame or if clarification is needed. Question 3. A med tech is preparing to administer a transdermal patch. What must be done before applying a new patch? Is it A, apply the new patch directly over the old one? B, shave the application site? C, remove the old patch and clean the skin? Or D, cut the patch to fit the location? All right, I see some correct responses coming through. Revealing the answer in 3, 2, and what you must do before you apply a new patch would be C. After you remove the old patch, you're going to clean the area to avoid overdose and irritation. And then we rarely put a patch on the same exact location unless it's specifically ordered by the doctor. For example, sometimes the nitroglycerin ointment, if a person has poor circulation to their left leg, the doctor's going to write an order where we put the patch, the medication on that left leg to improve circulation. But outside of that, even with the leg, you're not going to continue to put it on the same exact spot. You can put it on the outer aspect, the inner aspect, but yeah, you do want to be moving the location of your transdermal patches. Question 4, which route of medication administration involves delivering medication directly into the stomach through a feeding tube? Would that be A, oral, B, enteral, C, intravenous, or D, rectal? So your patient has a feeding tube. How would that medication be delivered? And you're so smart. You're absolutely right. It is B. So enteral refers to administering medications via the gastrointestinal tract using a feeding tube such as a G tube, and that would be a gastric tube. And in some of your facilities, you may have to assist, but that means that the nurse has trained you on how to do so. Do not do something if you're uncomfortable or if you've never provided G tube care before. Question 5, when can a med tech give a PRN or an as-needed medication? Is it A, if the client requested? B, and this says MAP, so that'll be medication associate provider or assistant provider, when the MAP thinks the client needs it. C, only if there is a specific order, including reason and frequency. Or D, if a coworker agrees. I'm sorry to keep using all these interchangeable terms, but again, the term will change based upon your location and your state. So when can you as a med tech give a PRN medication? Yeah, there has to be an indication. So the answer is C. So PRN meds must have a valid order that includes the dosage, the frequency, and the reason for use. For example, Tylenol could be given for a fever. It could also be given for a headache. So if a patient only has it prescribed to them for a headache, and now they have an elevated temperature, and you decide to give the Tylenol, that's a medication error. You did not give it for the appropriate reason prescribed by the doctor. And so that nurse would have to notify the doctor of that elevated temperature because maybe we need cultures. So you just don't want to give a PRN medication because it's there without looking for the reason that it was initially prescribed. Question 6. What should a med tech do if a confused client refuses to take a medication? A. Try again later without documenting it. B. Skip it and mark it as given. C. Hide the medication in food. Or D. Document the refusal and notify per facility policy. Right? You're a confused client. They're refusing their medication. So, of course, you're going to do D. We're always going to document. That saves the patient and it also saves us. So, we're going to document. Med techs must follow documentation protocols and notify supervisors, which would be your nurses, when refusals occur. And what I usually do is I notify the nurse first, and then in my documentation include that the patient refused and that the nurse was notified. Otherwise, it's going to look as if you just, didn't give the patient a medication and you did not alert your supervisors. Question 6. What is required before altering the form of a medication, such as crushing a pill? Is it A, verbal approval from another med tech, B, a written order from a healthcare provider, C, client consent, or D, the med tech's discretion? Right. So before you crush a pill, before you alter a medication, you have to have B. There has to be a written order for you to do so. So crushing or altering medication requires a healthcare provider's written order. What do we mean by a healthcare provider? It's someone who can write prescriptions. That would be your doctors, your advanced registered nurse practitioners, or I think they call them APRNs now. It could be a physician's assistant, but it's rarely going to be your nurse or your charge nurse. So it has to be one of those advanced providers. And so when the advanced provider writes the order that allows you to crush a medication, that is when it could be crushed, because not all tablets can be crushed. Some are extended or enteric coated and can be harmful if altered. In addition, if you're finding yourself needing to crush that many of your patients' medications, maybe they don't need to be taking pills. Maybe some of those medications could be converted to a liquid form. So you notifying the nurse who then notifies the provider is so important, so that we can make sure this patient's swallowing abilities get assessed. And then on top of that, that we can change the form in which their medications are given. And that makes your life easier also. Question 7. You notice that a medication label doesn't match the MAR. That's your medication administration record. What should you do? A, give the medication and update the MAR later. B, document the label instead. C, hold the medication and review the physician's order. Or D, cross out the label and rewrite. So the medication label doesn't match the medication administration record. All right. And so if you chose C, you are a safe caregiver, and I love it. So med techs must not give medications with discrepancies. If something's not right, you have to alert somebody. And so from there, we're going to follow the facility policies to make sure that we avoid medication errors. 8. If a patient's medication appears different than usual, what should you do? And I've had this happen before. Is it A, assume the pharmacy, change manufacturers, and proceed? B, ask the resident if it looks familiar and then give it? C, stop and verify with the nurse or pharmacy before administering? D, give the medication anyway to avoid delaying care. And those patients know how many pills they receive. They know the colors and the shapes. And so if you bring a pill in stating that it's one thing, but the appearance looks different, your patient, your resident, they're going to be questioning you. but you should have been the first one questioning. So it's going to be C. You got to stop. You got to make sure this is the right pill. Sometimes your facilities do change manufacturers, but maybe the pharmacist made a mistake. So any change in appearance should be confirmed to avoid administering the wrong medication. Great job. I'm happy you got that correct. Question 9. A medication aid may administer which of the following? A. Oral medications that have been pre-approved by the nurse. B. IV medications if no nurse is available. C. Chemotherapy agents. Or D. Narcotic injections. Revealing the correct response in 5, 4, 3, 2, and 1. It is A. Medication aids can administer certain oral medications, but must follow state and facility guidelines. Let's say a patient has cancer and they have their chemotherapy, their medications are now oral. So that's not going to be something that the nurse is going to allow a med tech to administer. The nurse would have to administer that anti-cancer agent, but you can administer the other medications. So not all oral medications can be administered by a med tech or a medication aid. Question 10. Which of the following is an example of a common medication error? Is it A, administering a medication with water, B, administering medication without confirming the identity of the resident, C, checking the MAR before giving a medication, or D, washing hands before the medication pass? Which is a common medication error? Yes, it is B. You have to verify the identity of your patient. So giving medications to the wrong patient or wrong resident, it is a serious and preventable error. Always verify the resident's identity before giving medications. Question 11. Before giving digoxin, a heart medication, what must a medication aid do? Is it A, ask the resident how they feel, B, check the blood sugar levels, C, take the apical pulse and report it to the nurse if required, D, administer it with orange juice? And this may be a new term for a lot of you all, especially if you're not in nursing school. So I want you to make this note for digoxin. You're going to do C. You have to learn how to take an apical pulse. So before giving digoxin, the apical pulse must be checked for 1 full minute with a stethoscope. The apical pulse is taken over the heart. It's usually the 5th intercostal space, like mid-clavicular, and is required. Apical pulse is taken over the heart and is the required method because it's more accurate for detecting irregular rhythms. When a patient is taking digoxin, it's usually because they have atrial fibrillation. So their heart rhythm is irregular, which means that when you're taking a pulse, a radial pulse is also going to be irregular. There may be some heartbeats that have been skipped. And so the best way to obtain an accurate heart rate is to put your ears to their chest. You're going to use your stethoscope at the apex of the heart, and that's where you will determine the apical pulse. And so let's talk about the radial pulse, which is where you normally feel for a pulse. So the radial pulse is located at the wrist. However, when someone has an irregular heart rhythm, aka a patient who's prescribed digoxin, it is not the acceptable location for checking the heart rate. And this is an extra note that I want you to write, because if the apical pulse is below 60 beats per minute, you should not be given digoxin. Digoxin slows down the heart rate. And so if you give it and the heart rate's already below 60, that means that it's below normal. You're giving a medication that's going to slow it down even more. That means your patient can become dizzy. They can start having low blood pressure. So digoxin, apical pulse, hold if the heart rate's less than 60, and of course, notify your nurse if you have any concerns. So when you all tell me that, oh, all I'm doing is passing heart medications and all I'm doing is passing diabetic medications, and you see me cringe, I'm cringing because those medications have side effects. So if you're going to be a med tech or a medication aid, make sure you're a good one. All right, let's go to our next one, team. Question 12. Before administering medication, which 3 items should a med tech compare to ensure accuracy and safety? Would it be A, the client's name, room number, and diagnosis? B, the medication time, dose cup, and storage location? C, the medication label, the MAR, and the prescriber's order? Or D, the client's mood, appetite, and preferred drink? And while you read through that, I'm going to take a sip of water, so I'll give you 10 seconds on this one. I see some mixed answers coming through, but it is C. That's right. So a proper 3-way check means that you have 3 items in front of you. You have your medication that has the label. You have your medication administration record, which is also referred to as the MAR. And then you have the physician's order. So the physician wrote the order. The pharmacy dispensed the medication. You compare the physician's order to the label that is on the actual pill container. And then you compare that to what is either written or typed on that MAR. And that would be your 3-way check. And when you get through with that, you still have to go to the patient's bedside and then do your patient identifiers, ask for their name and their date of birth. So there are so many ways to prevent a medication error. If a medication error does happen, it's usually because you missed one of those steps. Question 13, which of the following is the legal responsibility of a medication aid? Is it A, diagnosing side effects, B, making drug substitutions, C, prescribing PRN medications, or D, documenting medications administered? What is a legal responsibility? Reveal the answer in 3, 2, and yes, it is D. Okay, so medication aids must accurately document all medications given. You do not diagnose, you don't prescribe. All of that would be outside of your scope of practice. 14, if a resident is asleep when you arrive to their room to give medication, what should you do? A, wake them gently and proceed as ordered. B, skip the dose without telling anyone. C, leave the medication at the bedside. Or D, give double the dose later. Yeah, this one isn't as tricky, but I can see you're torn between 2 different responses. And so the answer to 14 is going to be A. We have to wake them, you all. You have a time frame. You have to give your medications. And so medications must be administered as scheduled unless refused or held by the nurse. And so it would not be C. You would not leave medications at the bedside. The patient can wake up, knock them over, the roommate could take them, or someone's child, a visitor could come into the facility, or a confused person into that room and they could take the medication. So you should not leave any medications at the bedside. 15, what is the best way to ensure the right patient when giving medication? Is it A, ask another resident to verify the name? B, check the MAR and room number only. C, use 2 identifiers such as name and date of birth. Or D, recognize them by sight alone. And I already gave you this answer by mistake, so we're going to go ahead and continue. So the answer to question 15 is, of course, C. So always use 2 identifiers to avoid giving medication to the wrong patient. If your patient is confused, you don't walk into their room and say, hey, Mary Sue, I'm Eunice. I'm your med tech today. I'm here to give you your medication, because she's going to pretend as if she's Mary Sue. She didn't even hear what you said, probably. So whenever you knock and you enter the room, you're going to introduce yourself, and then you're going to ask, while you're looking at their armband, you're going to ask for their name. And if they are confused and unable to give you their name, you're going to have to use, sometimes your facilities will have a chart with a photo attached to their personal file, or you can get the nurse to verify that patient's identity. If you're in a hospital, every patient would have on an armband, but in some of your long-term care facilities, they do not have on armbands. So you will have to ask the person their name and their date of birth. If they're unable to tell you, that's when you would follow your facility's protocols, which might include asking your nurse. 16, after giving the medication, what is the next step? A, document it on the MAR. B, clean up the med cart. C, give a snack. D, return to the storage room. That is right, because if you don't document it, you have no proof that you did it. It is A. Medications must be documented immediately after they are administered. Question 17. If a resident begins coughing after swallowing medication, what is the first action? A, leave to call a supervisor. B, attempt the Heimlich maneuver. C, encourage the resident to cough. D, offer water immediately. So a resident begins coughing after swallowing their medication. Yes, that's a sign of aspiration, but it isn't necessarily a sign of choking, so you won't have to do the Heimlich maneuver. If the patient can cough, you're going to do C. You're going to encourage them to cough because coughing is the body's natural way to clear the airway. Do not leave the resident or offer them water until you are sure that their airway is cleared. Again, use of the Heimlich maneuver is only used if the resident shows signs of choking, not coughing. Coughing and choking, even though we use them interchangeably, coughing indicates they still have air exchange. Choking, there would be no air exchange. There would be no coughing. There would be a look of gloom. The patient will not be able to speak or cough, and that is when you would perform the Heimlich maneuver. 18. Which of the following should always be verified before administering medication? A, the doctor's phone number. B, the resident's dietary preferences. C, the date the medication was opened. Or D, the medication expiration date. Revealing the answer in 3, 2, and... All right, and so you all, it's not C, it should be D, so that is incorrect. It is D. It's even though it's nice to know the date that the medication was opened, the date that the medication expires is more important than the date that it was opened. So the answer again is not C, it would be D as in dog, because giving an expired medication can be dangerous. It might not be effective. So you always want to check the expiration date before you give the medication. Question 19. Which document is used by MedTechs to legally record the date, time, dosage, and route of each medication given to a resident? Would it be A, a physician's order sheet, B, a medication administration record or a MAR, C, an incident report form, or D, daily shift communication log? And I don't expect any of you to answer this one correct because you are so smart. And that's right. You know that it would be B, MAR. So the MAR is a legal document used to track and document all medications administered, including the time, dose, route, and any omissions or refusals. Excuse me. Question 20. Which of the following lists all of the recognized rights of medication administration? And this is a long one. So would it be A, right resident, right doctor, right appointment, and right insurance? Would it be B, right time, right lab result, right diagnosis, and right billing? C says right medication, right dose, right resident, right time, right route, right documentation, right reason, right response, right education, and right to refuse. And D states right location, right shift, right nurse, and right routine. Which of the following list all of the recognized rights of medication administration? And that's right, it is C. I'm not even going to go to the next screen. I need for you to write these rights down. You have to know these. All right, and so it is C, you all. And let's talk about, we understand the right medication, the right dose, the right resident or patient, the right time, the right route, the right documentation. Remember, we talked about Tylenol being for a headache and or for a fever. You have to make sure that you're giving that medication for the right reason, the prescribed reason. And let's say we're giving it for a headache. An hour after your patient's headache has worsened, it went from a a 5 on a scale of 0 to 10, and now it's a 9. That Tylenol did not have the right response. That would be a reason that the provider would need to be notified. You have to notify the nurse so she can call that doctor, because there's no reason that the headache should be getting worse after being administered Tylenol. The right education. Maybe this is a new medication. As a med tech, as a medication aid, you would not be providing the medication. That would be the nurse's duty. All right. And then the right to refuse. Yes, they don't have to take their medications. They can refuse. So following all ensures safe and legal medication delivery. And so if you learned something new, give us a thumbs up. If you haven't already done so, don't forget to subscribe to our channel. Question 21, and we're going all the way to 70, team. A med tech is preparing to administer eye drops. What action ensures proper technique? A, touch the dropper tip to the eye. B, apply drops to the lower conjunctival sac. C, place drops directly on the cornea. D, insert drops with the client's eyes closed. Now, D makes no sense. So we're not putting eye drops on the exterior of their eyes. So everybody, the answer would be B. It has to go into the conjunctival sac. So drops must be placed in the lower conjunctival sac to avoid injury and ensure proper absorption. You're not going to put it directly on the eye itself. 22. Before giving a medication, a med tech checks the label, the mark, and the order. What is this called? I just mentioned it. You got to get this right. I have faith in you. Is it A, double verification method, B, the two-way check, C, a safety check, or D, the three-way check? Let's see how good your retention is. Did you retain this information that I just covered? And if you chose D, the three-way check, you have it. Ding, ding, ding. So the three-way check compares the label, the mark, and the order to ensure the right medication is given to the right person. 23, which of the following is outside the scope of practice for a medication aid? Remember, when I say medication aid, it could be med tech, it could be a qualified medication provider or associate. All these terms are used interchangeably depending on your state and your facility that you work in. So with that being said, which one is outside the scope? Would it be A, giving a resident their oral medications, B, documenting medication refusals, C, injecting insulin, or D, observing for side effects? Yep, and it is C. You all cannot give injections. So giving injections is not within a medications aid's role in most states. Always follow your state's regulations. If you decide to practice outside of your scope of knowledge and that patient is injured, not only could you be charged with, abuse and neglect, but you could be charged with, maybe you're telling people you're a nurse. So just be very careful. You are not a nurse. You are a med tech. You're a medication aid. I need for you to know the rules regarding the profession that you choose. 24, what should you do with a medication that requires refrigeration? A, place it in the designated medication refrigerator. B, keep it in a resident's personal refrigerator. C, store it in the nurse's office. Or D, leave it on the medication cart. Great job. It is A. We can't put it in the patient's refrigerator, but they're going to try. They're going to ask, why can't I just keep this in my room? No, for safety, we have to store this. So medications requiring refrigeration must be stored in a temperature-controlled medication refrigerator that is located in a secure location. So you'll usually have a med room. And so within your med room will be where the refrigerator for medications would be located. 25, what does it mean if a medication is enteric coated? Say that word with me, enteric coated. Does it mean A, it can be chewed for faster effect, B, it can be crushed and mixed with applesauce. C, it must be dissolved in water. Or D, it is coated to protect the stomach and should not be crushed. And some of your aspirins have an enteric coating. So whenever you see something that has a coating, that means that more than likely that medication irritates the stomach lining. So it's going to be D. Enteric coated pills are designed to dissolve in the intestine, not the stomach. Crushing them defeats their purpose and can be harmful. 26. Which of the following best describes a medication aid's responsibility? Is it A, make decisions about adjusting medication dosages? B, monitor and report changes in the resident's condition? C, assess the effectiveness of medication? Or D, change medication orders when needed? All right, giving you a few seconds to answer this one. Yeah, you have it. It is B. Medication aids observe and report, and they do not make clinical assessments or alter treatments. Question 27. A resident is scheduled to receive medication at 8 a.m. When is it considered on time? Would it be A, exactly at 8:30 a.m. only? B, within 1 hour before or after? C, within 2 hours before or after? Or D, anytime during the shift? Yeah, you remember from question number 1 or number 2, it would be B, because most facilities allow a 1 hour window before or after the scheduled time. So if your patient's medication was due at 8 a.m., usually at 7 a.m., you're too busy, but you have that hour window before and that hour window after. So an 8 a.m. med could legally be given between 7 a.m. and 9 a.m. unless otherwise stated by your facility. 28. Which of the following demonstrates the right documentation? A, recording meds before giving them. B, using whiteout to fix a mistake. C, initialing the MAR immediately after giving the med. Or D, leaving the MAR blank for the next shift. You have it. Great job. It is C. So MAR should be completed right after administering medication. Errors, we don't use whiteout. If you make a mistake, you use one single line to cross out. We always need to see the original entry, and then you'll put your initial at the end of that line. And so if you do make an error on your MAR, no whiteout, no scribbles, one line with an initial, and that way we know who made that change in the medical record. 29, a resident is on a fluid restriction. What should you consider when administering oral medication? A, give medications with large amounts of water. B, mix the medication in applesauce. C, mix the medication into drinks to help them swallow more fluids. Or D, use the minimum amount of water required. All right, giving you a few more seconds with this one because this one's a little more tricky. You have a resident on a fluid restriction who needs to take their oral medications. You're going to do D. That's right. You're going to use the least amount of water needed to safely swallow the medication and stay within the fluid limits. You cannot do B. You cannot do C. If you mix it in the applesauce, first of all, I don't have a swallowing issue. I have an issue with retaining fluids. So I don't want you crushing up my pills and putting them in applesauce. That's not something that you would do anyway without a doctor's order and also notifying that patient. So it would not be B. It also would not be C, because if you mix the pills, the crushed pills in, let's say, my orange juice or another beverage, what if I don't drink that beverage? If I don't drink it all, they still did not receive their full dose of their medication. And so you can give medications while also adhering to the fluid restriction. 30, a resident's blood pressure is too low before a scheduled antihypertensive dose. What should you do? A, wait 10 minutes and recheck. B, give the medication anyway to maintain the schedule. C, hold the medication and report to the nurse. Or D, ask the resident if they still want it. So they have a scheduled antihypertensive medication. You check their blood pressure, and the blood pressure is too low. What should you do? Yes, it's going to be C. You're going to have to hold that medication, notify your nurse, because antihypertensives can lower the blood pressure even further. And so that nurse needs to come in and assess and possibly even call the doctor. We want to make sure that we don't lower that blood pressure any further. Question 31. A resident begins scratching and develops hives shortly after receiving a new antibiotic. What type of reaction may be occurring? Would it be A, a therapeutic effect, B, adverse reaction, C, desired side effect, or D, drug tolerance? All right, we see some great answers coming through. Yes, it would be B. That would be an adverse effect or an adverse reaction. So hives and itching suggest an adverse reaction, which may be an allergic response that requires immediate attention. Question 32. A resident spits out a medication after attempting to swallow. What should you do? Would it be A, force them to swallow it again? B, ignore it if most of the pill is taken? C, try giving it again right away? Or D, report to the nurse and document the incident? And I know that the answer for a lot of these were follow your facility's protocols, notify the nurse. Well, that's because there's only so much you all can do as a med tech. So if that patient spit out their pill after attempting to swallow it, more than likely you're going to need a new pill. You got to document there's a discrepancy. It's going to be D. Any refusal, spitting out, or incomplete dose must be reported and documented. It's not that we're trying to undermine you. It's that whatever you're doing falls under that nurse's license. And so let's say it was a narcotic, it was a pain medication that the patient spit out. You and the nurse would have to witness. She'd have to waste that medication. Two people would sign off on it before another medication could be given. Otherwise, it may be looked upon as you trying to steal a medication. So follow the protocols. Question 33. Which drug class is designed to relieve pain? Is it A, antibiotics, B, analgesics, C, antacids, or D, diuretics? That's right. As a med tech, you have to learn your drug classifications. So antibiotic, analgesics, antacids, or diuretics. If something is relieving pain, it is going to be B. It is an analgesic. So analgesics relieve pain and can be over the counter, such as Motrin, or it could be a prescribed medication also. Question 34. Which type of medication is used to reduce inflammation? Would it be A, a corticosteroid, B, an inflammatory agent, C, an antipyretic, or D, antihistamine? Give you a few seconds to read over that one. I know that one may be a little bit trickier than normal, but you have your paper, you have their pen there, and you came here to learn. And by golly, that is what we're going to do. So a medication that reduces inflammation would be A. Yes, it's a corticosteroid, or we just call them steroids for short. Reduce inflammation are commonly used in conditions such as arthritis or asthma. Let's go back and look at the others. Inflammatory agent, you're not going to give a medication that causes inflammation. So that's just something I made up. An antipyretic, C, that could be something that would lower the temperature. And then D, an antihistamine, that would be used not necessarily for inflammation, but for hives, itching, and allergic reaction. So that would be an antihistamine. All right, 35. Which of the following medications is classified as an anticoagulant? Would it be A, digoxin? Would it be B, albuterol, C, metformin, or D, warfarin? All right, so which of the following medications is classified as an anticoagulant? I need for you to understand your prefixes, your key terms. Anti is against, and then coagulant is something that clots. So which of these would be a medication that prevents blood clots? And if you chose D, warfarin, great job. So warfarin is an anticoagulant that prevent blood clots, and med techs must observe for signs of bleeding because it thins the blood. How would you know if your patient's bleeding? Well, when they brush their teeth or their gums bleeding. So things like that you want to be asking your patient about. What's the color of their stool? If they say their stool is black or tarry, that could be an indication of, number one, maybe they're on an iron supplement, but it could be something worse. It could be that they're bleeding internally. So you want to be monitoring. That's why we have you document the color of their stool and the consistency, etc., because we are the eyes and the ears of the doctor. And so if you haven't done so already, you see that subscribe button and that bell. Some of you are like, Nurse Eunice, when do you come on? My schedule is all over the place, but I do try to come on here at least twice per week. But you'll know when I come on if you subscribe and turn your notifications on. Question 36. Which condition would most likely be treated with bronchodilators? Is it A, diabetes, B, hypertension, C, asthma, or D, seizures? Why would a resident need a bronchodilators? Bronch, what is that referring to? Dilator, what is that referring to? All right, so if it's not constricting, it's dilating, it's opening up. When you think of bronch, think of bronchioles, the branches at the very base of the lungs. So we need someone's airway to open. What are we going to give? It's going to be a bronchodilator. Who needs their airway open? It would be somebody with asthma. It is C. Great job. So bronchodilators open the airways and are commonly prescribed for asthma and other respiratory conditions. So you have to understand prefixes, key terms, and suffixes for you to be in the healthcare field. And we have videos on that. We have a library of medical terminology practice tests to help you learn these terms. Question 37. Which medication route is used for applying creams and ointments? Would that be A, oral, B, topical, C, transdermal, or D, rectal? So when we tell you about the right route, these are some of the routes. But which route is used for applying creams and ointments? Yes, yes, yes. It's not C. It's not C. It is B. Topical medications are applied directly to the skin for local effect. So if someone got bit by an ant and they had redness on their hand, inflammation, you may have to put on a corticosteroid. We're going to put a topical cream on their skin. Yes, you have to wear gloves. If you don't wear gloves, well, now you and the patient are being treated for this ant bite, but only the patient got bit. So always wear gloves when you are giving or applying topical medications. Question 38. A resident needs eye drops and ear drops. Which should be given first? Why does it even matter? A, are you going to give the eardrops first? B, the eye drops first? C, it doesn't matter? Or D, ask the resident their preference? Miss Eunice, what would you like first, your eye drops or your eardrops? I know we teach you all about this compassion and getting, including the patient in their care, but this one honestly is going to be B. You all do the eye drops first because whenever you're instilling eardrops, the head may need to be remain tilted for several minutes. And so if you put the eardrops in and then tilt the head, what happens to the medication you put in their eyes? It might run out also. So you administer your eye drops first to avoid, any medication from coming out of the eyes because you're putting in their conjunctival sac. But then on top of that, it avoids you having to change the position. So do the eye drops, then tilt their head, do the eardrops, remain with them for the 2 to 3 minutes, whatever the medication requires to make sure that that medication gets into the ear canal. 39. When a resident takes sublingual nitroglycerin, you should do which of the following? Is it A, have them chew and swallow it slowly? B, place it against the inside of their cheek? C, place it under the tongue? Or D, give it with water? Sublingual. You're given a sublingual medication. So sublingual is a route. And so with sublingual medications, you do C, it goes under the tongue. So sublingual medications such as nitroglycerin and also B12 must be dissolved under the tongue to be effective. Question 40. What does it mean when a medication order says give with meals? Is it A, give 1 hour after meals? B, give before bedtime? C, mix the medication into the meal? Or D, administer while the resident is eating or shortly after? What are we meaning when we say give that medication with a meal? And then I always like for you to ask why. You may not be asking your nurse why. You're going to refer to your drug reference materials, the intranet in your facility, because if you're given something with meals, that must means that it irritates the stomach. So it's going to be D. With meals means during or immediately after eating to improve absorption or to reduce stomach irritation. So read those labels carefully. Question 41. Remember, we're going all the way to 70, so thank you for being here so far. What must you always check before administering an anti-diabetic agent? Would it be A, the blood sugar level, B, the blood glucose level, C, the pulse, or D, the blood pressure? And for this one, oh, that vehicle's loud. For this one, I will accept 2 answers. So, what do you always check before administering an anti-diabetic agent? So today we've learned about antihypertensives, we've learned about anticoagulants, and now we're talking about anti-diabetic agents. And so if your patient has diabetes, before you give something that's going to fight their diabetes, aka regulate their blood sugars, you need to know either A or B. We have to know the blood sugar level, or another term for that would be their blood glucose level. So whether you chose A or B, you are correct. So anti-diabetic agents lower the blood sugar. So it's essential to check the blood glucose level before administration to avoid hypoglycemia. Hypo means lower than normal. Glycemia refers to the glucose within the bloodstream. So hypoglycemia, or in other words, a dangerously low blood sugar level. 42. Which of the following medications helps break up mucus in the lungs? Is it A, expectorant, B, antacid, C, antihypertensive, or D, diuretic? That's right. You're going to learn these medications. You're going to be knowledgeable when you're standing in front of your residents and your patients and you're passing medications. Again, even though you may not perform the initial education, you are responsible for knowing the side effects, what these medications do. And so a medication that breaks up mucus in the lungs would be an expectorant. It is A. So an expectorant loosens the mucus, and once it's loosened, it's going to help that patient cough it up. And so a natural expectorant is give your resident fluids. Give them some water. That's going to thin out the mucus. And so if you're just giving them expectorants, but you're not asking them to increase their fluid intake, it's still going to be, sometimes they have that non-productive cough where you can hear the rattle, but nothing's coming up. Well, we're going to give them expectorant, but we're also going to encourage them to drink more fluids. We don't have to overdo it, but hey, let's try to drink at least, a cup or 2 of fluid every 8 hours, at least once per shift, especially if the patient doesn't have a fluid restriction. 43. A resident's MAR says furosemide 20 milligrams PO daily at 9 a.m. You notice they haven't had any output since yesterday. What should you do? Ooh, this one's loaded. Number one, you have to know abbreviations. Number two, you have to know medications. And then three, you have to know interventions. You want to be a med tech? I'm helping you get there. So the MAR says furosemide, 20 milligrams PO, that means by mouth, daily at 9 a.m. What is the purpose of furosemide? You notice they don't have any output. They've not had any output since yesterday, but they're not telling you what type of output. Would that be urine? Would it be blood? Would it be mucus? Would it be fecal matter? Did it not have a bowel movement? So you have to know your medications. Is it A, do you give the medication? B, hold the dose and wait? C, push fluids to help? Or D, report it to the nurse before giving it? So your resident, furosemide, 20 milligrams, PO, daily at 9 a.m. They've not had any output. Yes, if you notice something wrong or something strange, you have to report it to your nurse. So furosemide is a diuretic. It removes excess fluids from the body by causing your patient to urinate more frequently. So furosemide is a diuretic. Lack of urine output may signal an issue. Is there an obstruction? What's going on? Why isn't this patient urinating when I'm giving them a medication that is designed to make them urinate? So the nurse should assess that patient before you administer your next dose. Otherwise, the patient could end up retaining urine. They may need a catheter. So it's just a lot that goes into that. Get your nurse into the room. When in doubt, call your nurse. 44. Which of the following is a route of medication administration that a medication aid is typically not authorized to use? Is it buccal, topical, rectal, suppository, or sublingual? Ooh, I see you're torn. Is it A or is it C or is it D? I see the rainbow on this one. I see all the letters of the alphabet, but you all, what you can't do is anything invasive. So you cannot do C, rectal suppositories. So medication aids are generally prohibited from inserting rectal suppositories, as this is considered an invasive procedure. It must be performed by a nurse or licensed provider. And so I know some of you are like, well, I'm a CNA and I have a license. According to the National Board of Nursing, nursing assistants, PCTs, they are classified as unlicensed assistive personnel. So I know you have a license, but in the Board of Nursing eyes, you are not a licensed practical nurse. You're not a registered nurse. So in their eyes, you are unlicensed. I know that may be confusing, but if you're unlicensed, if you're a CNA, a PCT, or a medication aid, you cannot do anything invasive. Question 45. Before giving a resident a potassium supplement, you should do which of the following? A, check if they've eaten. B, check if they're on a stool softener. C, check if they're allergic. Or D, give with water. Yeah, I will accept two answers for this one. But if someone's allergic to potassium, they're going to die. Like literally, they're going to die because your body needs potassium. Your heart needs potassium. Your muscle needs potassium. So everybody answers not C. I've not had one patient with a potassium allergy. You literally cannot live without potassium. So you all, before you give a resident potassium, you should do A. You have to check to see if they've eaten, because potassium supplements, especially in tablet or capsule form, can cause stomach irritation, nausea, and even ulcers if taken on an empty stomach. Giving potassium with food helps to minimize gastrointestinal side effects and improves tolerance. Plus, these are big old, your patients are going to call them the horse pills. They are huge pills. So whenever you're thinking of potassium, it's usually given with breakfast. If they're taking them twice per day, we're going to give them with breakfast. Or if it's past dinner, make sure that patient receives a bedtime snack, whether they're a diabetic or not, because you don't want them taking potassium on an empty stomach. 45. Which of the following oral routes delivers medications by dissolving it between the gum and cheek? Is it A, sublingual, B, buccal, C, enteric coated, or D, parenteral? And you all make me so proud. I get so many messages. I may not respond to all the messages, but when I see those messages from you from all around the globe, all around the world, telling me that you passed your examinations because I spent 30 minutes to an hour coming on and just doing review questions with you all, that gives me purpose. And so if I haven't told you how much I appreciate you for learning, for watching, for wanting to be the best healthcare providers possible, let me let you know right now, I appreciate you. So, question 45, the answer is B, buccal. So, buccal administration refers to placing the medication between the cheek and the gum, allowing it to absorb into the bloodstream without being swallowed. We may do that for our patients who are on hospice. So, we know right now it's not safe for them to swallow anything. Maybe they're becoming less responsive, so we can give their medications via the buccal route. 46. Which of the following routes delivers medications into the muscle? Is it A, PO, B, IV, C, SC, or D, IM? And if you don't know your medical abbreviations, of course we have a video for that on our YouTube channel. So you have to know your abbreviations. You have to know these acronyms. And so let's go through them together. Put it in chat. What does PO stand for? What does IV stand for? What does SC mean? And what does the abbreviation IM refer to? All right, give you about 10 more seconds and then I'll reveal the correct response. Yep, you have it. That is right. That's right. I see some great responses coming through. So A, PO is not the correct response. PO stands for oral. B, IV isn't the correct response because IV refers to intravenous. That means it's in the vein. CSC is not the correct response because SC stands for subcutaneous, as in it's in the fat layer. And so that would be something similar to like an insulin injection. And then DIM is the right answer. IM stands for intra, that means inside the muscle. So IM is intramuscular or intramuscle. And that is usually for those medications that have to be administered in the muscle because they're irritating. So you all, even though you can't perform it, you have to know your abbreviations because if you're given a medication thinking, oh, IM stands for something else, and you decide to go ahead and give this injectable and you give it via the wrong route, you've caused a serious medication error. And there it goes again, is D, because medications given IM are injected directly into the muscle tissue. 47. You're assisting with an inhaler for a resident. What should you do immediately after the resident inhales the dose? A, give water. B, ask the resident to exhale. C, have the resident hold their breath for 10 seconds. Or D, apply lotion to their lips. Right, so your patient with asthma, they have their inhaler. You have to know how to use it. You're going to help them with it. And so you're going to hand it to them and you're going to tell them to do which of the following. Okay. It's C, that's right. They have to hold their breath for as close to 10 seconds as possible because holding their breath allows the medication to settle in the lungs for maximum effectiveness. 48. Which medication route avoids the digestive system and delivers medication directly into the bloodstream the fastest? Ooh, is it sublingual, rectal, oral, or intramuscular? And notice it says the fastest, so this may be something new for you. All right, revealing the answer in 3, 2, And believe it or not, it's not D, it's A. So that's why they're nitroglycerin, they're having chest pain. We have them put one or tabs beneath their tongue because sublingual medications absorb quickly into the bloodstream through tissues under the tongue, thus avoiding that digestive process, that 30 to 45 minute, etc. And so the other one that would, of course, bypass the stomach and provide fast distribution of medications would be IV or intravenous, but that wasn't one of the options there. So it would be sublingual, which is a route that a med tech can actually use to administer medications. All right, our next one, team, is 49. A resident's medication order says give eardrops to right ear. Which step is incorrect? Is it A, warm the drops by rolling in your hand? B, pull the ear back and down? C, insert cotton deep into the canal? Or D, have the resident tilt their head? And the question wants to know which of the following actions would be incorrect. All right. And it's going to be C. We don't want to put cotton deep into the canal. Everything else is something you would actually do. So yes, you'd have your patient, you would actually warm up the eardrops by rolling them in your hands. You will pull the ear back and down. And of course, you have to have your resident tilt their head. So if you're putting an eardrop in the right ear, you'd have them tilt their head towards the left. Here's our rationale. You cannot use cotton deep in the ear canal because cotton may be used loosely to prevent leakage, but it should never be inserted deep into the ear canal as this can cause ear injury. Question 50. Which of the following is considered a controlled substance? Is it A, acetaminophen, B, ibuprofen, C, morphine, or D, vitamin D? Yep, everyone answered this one correctly. It is C, morphine. Morphine is a narcotic pain reliever and classified as a controlled substance, requiring secure storage and special documentation. Usually, you're going to have someone sign out the morphine with you. And so it's under double lock and key to make sure that we don't have any narcotics being lost or stolen. 51. When assisting with a metered dose inhaler, or for short, MDI, the medication aid should instruct the resident to A, inhale quickly before pressing the canister, B, press the inhaler and inhale at the same time, C, exhale fully after inhaling the medication, or D, use it before rinsing the mouth. So your patient has their asthma pump, or they have their Spiriva, your metered dose inhaler. The medication aid should instruct the resident to do which of the following? And that's right. The only one that makes sense is B. They have to press it and inhale at the same time. Otherwise, they're not going to get their medication into the lungs. So it's going to be B. Proper coordination ensures the medication reaches the lungs. Rinsing the mouth may follow, but it's never before, it's always after. And usually we have them rinse their mouth because some of those metered dose inhalers contain steroids. And steroids, if left on the face, if left on the tongue, can cause thrush. Remember, people who are on steroids, especially for prolonged periods, they usually have a weakened immune system. So keep all that in mind. And if that container, if that medication, if it says rinse after use, help your resident rinse their mouth after using it. 52. Which statement about medication administration routes is true? A, all patches should be placed over the heart. B, sublingual meds must be swallowed immediately. C, suppositories may be given by med aids in emergencies. Or D, eye medication should be placed in the lower eyelid pocket, which is true. Excuse me. Yeah, it is D. Yeah, so lower eyelid pocket, aka conjunctival sac. So this allows the medications to absorb properly without damaging the eye surface. 53. A nurse asks you to assist a resident with a vaginal suppository. What is the correct response? A, I'll chart it after I give it. B, that's outside my scope. Please assist instead. C, I've done it before and don't mind. D, only if the resident agrees. This one's tricky. But if you've watched this video, you know that a med tech or medication aid cannot do anything invasive. So that's outside of your scope of practice. It's going to be B. Medication aids are not permitted to insert. You can't insert, you can't inject. You can't do it. I don't care how much you want to do it. You cannot do it. So you cannot insert anything into the vaginal area or into the rectum. That is outside of your scope of practice. That is the nurse's duty. Question 54. A transdermal patch is removed and the skin appears red and irritated. What should you do first? A, apply cream to the irritated area. B, place a new patch on the same spot. C, clean the site with soap and water. Or D, report it to the nurse. And I'll give you about 5 seconds to answer this one. I know which one you want to do, but that may not be the right answer. So if you want to do C, wrong answer, it's going to be D. So you all, if something's irritated, you don't put soap on it. If something's irritated, you don't put soap on it. If something's irritated, you notify your nurse. And so skin irritation must be assessed by the nurse. The patch should not be reapplied in the same spot until cleared. Do not apply soap to an irritated area without asking your nurse first. And now as the nurse, when you're telling me, I'm probably going to tell you to hold off on giving that patch until I can call the doctor. So I'm going to go in, I'm going to assess that patient's skin. I'm going to ask, hey, have you had this type of flare up before? Is this a new medication? I need to do my research because maybe the patient is allergic to the medication. So you just going and putting on a new patch in a different area and not telling the nurse would mean that now this patient's rash could be spreading. So I'm going to come in, I'm going to assess. If I do clean, I'm going to be cleaning with just warm water only, pat dry. I'm not using any soap. I'm going to monitor that area. I'm going to notify the doctor to see what the doctor suggests or recommends, and then we're going to update that order. 55. We have 15 more left. A medication aid may assist with which of the following? Is it A, administering IV antibiotics, B, applying medicated ointment, C, giving rectal Tylenol, or D, inserting insulin pens? Yeah, this one's super easy. I think I've drilled it in your head. You can do B. You can do topical. You can do eye drops. You can do ear drops. You can do oral medication. Some of your facilities, you can do enteral, but you can't do anything invasive. So medication aids may assist with topical medication applications. However, injections and suppositories are outside your scope of practice. 56, a medication is to be given PR. What does this abbreviation indicate? Is it A, orally, B, as needed, C, rectally, or D, by IV? So I need you to understand, as a medication aid, all of the residents, all of the patients' medications are on one MAR. You have to know the routes so that you know what medications apply to you. And so if you see something that says PR, that is not PRN. PR is per rectum. So that is C. PR, again, stands for per rectum, indicating that a medication should be administered via the rectal route, which you are not allowed to perform. 57. Which resident situation requires notifying the nurse immediately before giving a scheduled medication? Is it A, a resident with a mild rash on their arm? B, a resident with a blood sugar of 65? C, a resident with a blood pressure of 118/78? Or D, a resident that complains of having a dry mouth? Which would you notify the nurse about immediately? Revealing the answer in 3, 2, and yes, it is B, because a blood sugar of 65, usually less than 70 in some of your facilities based on that patient's condition, is considered hypoglycemia. So if it's 70 to 80, that's borderline. We're monitoring them. Let's go ahead and get them something to eat. But 65, maybe they've been NPO for a while. We need to make sure this patient's not about to have a hypoglycemic episode. So you get your nurse in the room, keep checking those blood sugar levels according to your facility's policies. But med aides must report abnormal blood glucose levels before giving anti-diabetic meds. So if you give an anti-diabetic med and their blood sugar is already low, you can bottom them out, causing their blood sugar to drop. Remember, the brain needs the sugar. When their sugar gets really low, they become very sleepy, hard to arouse. They can start becoming confused. They can begin sweating. And so that's when we say they're in the diabetic coma, is when they're unresponsive. So you always check blood sugar levels before you give oral anti-diabetic medications. And then your facilities, especially if a patient has diabetes, usually they will have these scheduled blood glucose checks where they'll say ACHS. And so AC refers to before meals and HS refers to bedtime. 58. Which of the following is one of the rights of medication administration? Is it A, right insurance, B, right diagnosis, C, right patient, or D, right physician? Yep, it is C, right patient. So I know earlier we talked about like 10 rights. Depending on where you are, there could be 5, there could be 10, there could be more than 10. But the main 5 are the right medication, the right patient, the right medication, the right dose, the right route, and the right time. But remember, early in this video, we discussed 10, and that is dependent upon where you work. But I think of the 10, I like the 10, the 5 or the main 5. But you also got to remember that, hey, if you gave a medication and it didn't have the right outcome or the right, the patient didn't improve, well, that would also be a right. And of course, the patient has the right to refuse. So learn the rights for your city, learn for your state, learn the rights for your school. But remember, in theory, there are 10 or more different rights to help you prevent medication errors. Question 59. What is the proper way to store medications? A, keep medications in a medication cart unless otherwise instructed. B, store medications in the resident's room for easy access. C, share medications between residents when running low. Or D, store medications with food items to save space. Yes, it is A. Medications must be stored securely and accessible only to authorized personnel, which is why we have medication carts. And when the medication carts are not in use, they're usually going to be locked in the med room. So we have med rooms, we have med carts, but we have multiple designated areas to keep those medications safe. Question 60. Which of the following situations may indicate possible medication diversion by a caregiver or staff member? Is it A, the resident reports feeling better than usual? B, medication counts are consistently accurate? C, PRN medications are charted but not signed out? Or D, controlled substances are missing without explanation? And so the key term in your question was medication diversion. What does that mean? What does it mean to divert something? All right. So it is D, everybody. So medication diversion refers to the misuse or theft of medications. usually controlled substances like narcotics. So, unexplained missing medications, inaccurate counts, or altered documentation are all red flags. Diversion is a legal and ethical violation that must be reported immediately. So, if you think that someone's diverting medications, remember the date, remember the situation, the circumstances, but you want to let your director of nurse know, your charge nurse know, because whether you know it or not, they start keeping records and they're going to be they will start monitoring the NARC counts more closely, especially on the days when that person's at work. I know some of you all are thinking, well, Eunice, why isn't it C? Because C, this was a medication error because they charted that they gave the PRN medication, but they didn't sign it out. But at least, we need to check with the patient to see if the patient actually got it. The patient say, yeah, she gave me the medication. Well, that wasn't diversion. That was a medication error, but it was not diversion, because at least somewhere they document that this patient received the medication. They may not have signed it out, but if we go in and we count and we see that one pill is missing, well, it obviously went somewhere. So a medication error by itself does not mean that someone diverted medications. Question 61. A home care resident is stung by a bee and begins having difficulty breathing. You know they have a prescribed EpiPen. What is the most appropriate action? Remember, home care, you and the nurse are rarely in the home at the same time. So you're in this house by yourself. Your resident got stung by a bee and they have an EpiPen. What do you do? Is it A, wait to see if symptoms improve? B, call 911 but avoid touching the EpiPen? C, assist the resident in using the EpiPen? Or D, crush an antihistamine and give it by mouth? All right, I see some great answers. And yes, you have it. So you all cannot give injections, but you can help that patient give their own injection. So the answer is C. In most states, med techs are permitted to assist with an emergency epinephrine auto injector, aka EpiPen, if it is prescribed and part of the care plan. Remember, you are not administering the injection, you are putting the EpiPen in your resident's hand. All right, so you're going to be helping them to self-administer their own medication in a life-threatening emergency. And then if you have to use the EpiPen, have your cell phone out, put it on speakerphone and call 911. So here it says, after use, always call 911. I'm sorry, as soon as I realize my patients have an allergic reaction that's that severe to where they're wheezing, maybe their face is flushed, or saying they're having a hard time breathing, yes, they may have an EpiPen, but I'm using my phone at the same time as I'm holding their hand and helping them self-administer their epinephrine. So I think in an emergency, you'd be able to do both. You can always put that phone on speaker so that you don't have to hold it while you're helping to save your resident's life. Question 62. A resident appears confused, drowsy, and has shallow breathing. You suspect an overdose. What should you do first? A, take a full set of vital signs. B, stay with the resident and call for emergency help. C, leave the room to find a supervisor. Or D, try to get them to walk it off. I know, this one's tricky. They're confused, they're drowsy, they have shallow breathing. Do you want to get a full set of vital signs? Do you want to leave the room to get the supervisor? Or do you want to stay with them and call for emergency help? I would do B. You have to stay with them because these are classic signs of a drug overdose. So we're suspecting, hey, this patient, either the nurse gave them too much medication or maybe they took an illegal substance. And so if a patient overdoses, more than likely it was due to an opioid or a sedative. And so your immediate response is required. You're going to stay with the resident because what if they stop breathing? What if they go into cardiac arrest? You cannot leave them. You're going to stay with the resident, monitor them, and then you're, of course, notifying that nurse. And so there is a code button in your room. In your hospital settings, there's like this emergency button that when you press it, it alerts the entire floor, and it will get multiple people into your room. So if your nurse is a little slow getting to you, don't be afraid to activate that code button. Anyone can activate the code button, even family members. And again, never leave a resident who is injured, who's ill. Don't leave them alone. Stay with them, because again, if they go into cardiac arrest, we need you to start your CPR right away. 63. A resident is on 12 different medications, including blood pressure meds, sleep aids, and pain relievers. What term describes this situation? Is it A, polypharmacy, B, medication reconciliation? Is it C, multi-medications, or is it D, cross-tolerance? Right. I see we're torn between two different answers. So we're going to be revealing the correct response in 3, 2, and yes, it is A. It is polypharmacy. So that refers to the use of multiple medications by a single individual, often 5 or more. It increases the risk of drug interactions, side effects, and non-compliance, especially in older adults. The other term, multiple medications, that's just something I made up. And then medication reconciliation is when we check records. And so let's say a patient has a pharmacy. We need to get their list of medications from home. And sometimes they will have them, sometimes they won't. Worst case scenario, I can call the pharmacy. I can get that list of medications. And now I'm going to compare it to what records we have there in our facility. That comparison is called the medication reconciliation. We're reconciling the medications. We want to make sure they don't have duplicate medicines. So we're not going to have them take 2 medications that have the same effect unless the doctor specifically orders the medications to be given that way. Question 64. What is the proper response if a resident asks, what is this pill for? Remember your role. You're a med tech. Is it A, ignore the question? B, tell them it's none of their concern? C, inform the nurse so they can answer? D, answer their question? All right. Yeah, I know. I know you want to teach them. I know you want to answer their question, but you give the meds and the nurse answers the question. So it's C. Medication aids and med techs must stay within their scope of practice, which typically does not include explaining the purpose or mechanism of medication. So I'm going to go into the room. I'm going to introduce myself. I'm Eunice. I'm the nurse. Your doctor has ordered this particular medication. It says lisinopril. Lisinopril is going to help with your blood pressure. Your last blood pressure is 160/80. We want to bring that down to normal. And so a normal blood pressure would be 130/80. Do you have any questions about this particular medicine? Okay, well, if not, Cheryl is the med aid. She's the medication tech. She'll be in shortly with your lisinopril. Now, when you come in, you're going to be telling her what the pill is. But if she says, hey, why are you giving me this? You have to know that I've already explained that to her. So if a resident asks for a medication-related question, such as, what's this pill for? The correct and professional response is to refer the question to the nurse who is licensed and qualified to provide that information. You can say, hey, patient ABC, I thought your nurse was just in here and she told you that you're going to get a new prescription for lisinopril. And now the patient may be like, oh, now I remember. She said it was for my blood pressure. But you should not be doing the initial teachings. You just pretty much, you can remind them of what things are, but you don't want to go outside of your scope of practice. They're asking, what's this pill for? Try to refer them back to their nurse if possible. Question 65. A resident with COPD is prescribed oxygen at 1 to 2 liters per minute via nasal cannula. Their O2 sat reads 93%. I want to reread that. A resident with COPD, chronic obstructive pulmonary disease, is prescribed oxygen at 1 to 2 liters per minute via a nasal cannula. Their current oxygen saturation reads 93%. Can a med tech increase the oxygen flow? A says yes, increase to 2 liters per minute because there's an order. B says yes if they're short of breath. C, maybe. D, no, only a nurse or provider can adjust oxygen orders. Yeah, this one's tricky. But if you've been watching my other videos, it's not tricky to you. Because if you've been watching our videos, you know that you cannot adjust the flow of oxygen. I don't care if the order's there. That order is not for you. It's going to be D, you all. Oxygen's a drug that has to be regulated by nurses, respiratory therapists. It cannot be regulated by the med tech or the CNA. So med techs must never adjust the oxygen flow rate. And when I say specifically instructed by a nurse, if I'm a nurse, I'm not going to tell someone who, according to the Board of Nursing, is unlicensed to adjust the flow rate. It has to be an emergency where I am applying pressure. I cannot release my hands to turn a dial. That's how serious it has to be for me to tell a CNA or a med tech to adjust the flow of oxygen. So what happens whenever you adjust the flow of oxygen, depending on the patient's condition, like a patient with COPD, if you turn their oxygen level up, their drive to breathe will be decreased. So for them, lower O2 sats are normal. 90 to 93%, we're okay with that. They need low flow oxygen. They do not need high flow oxygen. So let me read that rationale. Med techs must never adjust oxygen flow unless specifically instructed by a nurse. Increasing oxygen without authorization can be dangerous for residents with COPD who rely on lower oxygen levels to stimulate breathing. So when you think about COPD, when you think about emphysema, think about those chronic smokers with the cough, that chronic cough that's really not productive. They cough a whole bunch. Those are the patients who are usually going to be on low flow oxygen, 1 to 2 liters. And so if the patient's on 1 liter and you feel as if, or the patient's requesting that it's increased to 2 liters, even though the order's present, you cannot change it. The nurse must come in, assess that patient, and then adjust the oxygen levels. 66, a resident with chronic kidney disease is ordered a diuretic. You should be alert for, so let's rewind, let's go back. Chronic means they've had it longer than 6 months. Kidney disease, what organs are we referring to? Of course, the kidneys. So maybe this patient's on dialysis. All right, so they are not able to excrete toxins. So a resident with chronic kidney disease is ordered a diuretic. You should be alert for which of the following. Would it be A, increased blood pressure, B, dehydration and low potassium, C, insomnia, or D, vision changes? All right, the answer is, drum roll please, it's going to be B, because we're giving somebody who has a problem with excreting things, if we're giving them a diuretic, let's make sure they can actually urinate. So diuretics increase fluid loss, which can cause dehydration and sometimes potassium. Potassium is excreted also. So it can cause electrolyte imbalances, especially hypokalemia, which refers to low potassium levels. Remember, if the potassium is too low or it's too high, it can cause the cardiac muscles to start misfiring. They're going to start firing faster or slower. In other words, it's going to cause an abnormal heart rhythm, which could cause cardiac arrest. So it is so important when we're like, hey, check the potassium level before you give potassium. It's really important because we have to know the normal. So a diuretic, it increases fluid loss. It also can cause an electrolyte imbalance, and that's going to be seriously dangerous for a patient with kidney disease. So if they have renal disease or kidney disease, we always say no K without P. K from the elemental table refers to potassium. P stands for urine. So no potassium if they're not able to pee. Hope that makes sense. Write it down. If it doesn't make sense now, it will make sense whenever you're out there in the field. Question 67. What should a medication aide do if the medication cart is left unlocked? Is it A, lock it immediately and report the incident? B, ignore it if it's not your responsibility? C, wait for the nurse to return? Or D, remove medications to keep them safe? We're almost done, team. I am so proud of you. And so the correct response is going to be A, okay, because unsecured medication carts pose safety and legal risks, so you're always going to keep them locked. 68. What does BID mean on a medication order? Is it A, give twice a day, B, give before dinner, C, only give the medication twice, and then D, excuse me, give twice per shift? What does BID mean on a medication order? All right, revealing the correct response in 3, 2, and yes, it is. Hold up, make sure I had the right one. It's A, that's right. It is give twice a day. So BID is a standard abbreviation meaning twice a day. And you all, if you go to nurseeunice.com, I will put that in the chat. It should also be in the description. That's where you get all of our freebies. And there should be one there on medical terminology. So if some of these terms were new to you, you can't be a medication aide, you can't be a med tech if you don't understand medical abbreviations. So make sure you go and get your free download. Just scroll down until you see one that says medical terminology and abbreviations. All right, question 69. A resident with Parkinson's disease takes cardidopa or levodopa. What should the med tech observe for? Would it be A, swollen ankles, B, less confusion, C, sudden weight loss, or D, improved mobility and reduced tremors? A resident with Parkinson's disease takes their levodopa. What should the med tech observe for? So you have to know something about your patients. You have to know their conditions. Patients with Parkinson's disease, they have a shuffling walk or a shuffling gait, and they normally have tremors. So if you're given a medication such as levodopa, what you're monitoring for would be D. You want to make sure they're improving, that their walk is improving, that they're not trembling as much. Now, what's sad about this is that this cycle repeats itself every day. When the medication wears off, they start having the tremors again. They start, their walk won't be as coordinated, or their gait won't be as coordinated. But that's why when you're given something, you have to know the reason that you're giving it. So this medication helps to control Parkinson's symptoms like tremors and stiffness. Med tech should monitor for symptom relief and side effects like dizziness. It would not be less confusion, because if your patient only has Parkinson's disease and they don't have dementia, they should not be confused. So don't start combining disorders. A person can have Parkinson's without dementia, as a dementia patient can have confusion without tremors and a shuffling gait. Question 70. A resident with GERD, G-R-E-D, is ordered Prilosec. What time of day should it be given? Is it A, after meals, B, at bedtime, C, 30 to 60 minutes before breakfast, or D, with an antacid? So that's omeprazole, aka brand name would be Prilosec. So when a patient's taking Prilosec, what time of day or how should it be given? Yes, it is C. So Prilosec is a proton pump inhibitor. It works best. So that means it's like reducing the acids. It works best when taken before meals to reduce stomach acid production. And let me tell you, I am so proud of you. I'm so proud of you. As a reminder, if you want more practice tests, use your phone, scan a QR code that's on the screen. It's going to take you to our playlist that has the other medication aid practice tests that we have completed. And so I look forward to helping you study, helping you pass. And so a lot of my medication aids and medication techs, you were previously CNAs, or if you did it the reverse way, maybe you want to earn your CNA certification. What I want to let you know is that what you're doing it the right way. So whether you're a med tech or a CNA, if you are a great med tech or a great CNA, that tells me that you're going to be a great nurse. So keep doing what you are doing. If you need more free resources, go to our website, which is fltraining.com. You can also go there and schedule a class. And so, great job, team. We have studied for an hour and a half. Let me know your success stories. Let me know what you learned. Put it in the chat. I love you. I appreciate you. Thank you for watching. Don't forget to subscribe, and I will see you in the next video. Bye, everyone.